At the height of the pandemic, the team at Franciscan Health created a remote patient monitoring program, which allowed patients with COVID to avoid a potential hospital stay and instead recover in the comfort of their home. Our number one priority in this work was to keep our patients safe by providing them with additional support. This program gave them a way to self-monitor symptoms and provided a robust follow-up process with our clinicians.
So when patients come into the emergency department with suspected COVID or confirmed COVID, we carefully screen them. We rule out immediate life-threatening conditions. We also determine if they need to be hospitalized. And for many patients, actually going home is appropriate and possibly even safer. Many are candidates for remote patient monitoring. We send them home with a pulse oximeter, a thermometer, and an incentive spirometer. And we provide them with some training here from the emergency department. A respiratory therapist comes down and we provide them with some informational video and some handouts, as well as a log to keep track of their vital signs from home. And then they're contacted by a member of the ACO. That's either a nurse or a respiratory therapist. They're contacted daily for 7 days. They review their symptoms.
Unfortunately, I was diagnosed with COVID back in November 2020, but I was very fortunate to overcome it, recover, and I wouldn't have had an opportunity to recover as fast as I could or got back to work as soon as I could without the remote patient monitoring program that's been in place by Franciscan Health. And the kit was fantastic. It gives you all the information from A to Z, how to start it, what to do, when to go ahead and check your temperature or do your breathing exercises or check your oxygen levels. I was able to maintain those charts internally. I had at least 10 days of self-quarantining and just reminded myself that, that I was staying within those healthy levels and was going to get through this experience without any difficulty.
We do call the patients for a minimum of 7 days, but of course if patients are having complaints or increased concerns about their health, we will reach out and make additional calls until we feel that they are stable and comfortable to be on their own.
There was a specific person assigned to me, and those phone calls came in consistently right around 2 o'clock. I knew that call was coming, and I made sure I had my information ready to share. So that person had an investment in you, understood your vitals, understand the process you were going through, and felt like they were going to give you the one-on-one that you would get in an office setting, but you were getting out of the comfort of your own home.
I would say greater than 90% of the patients that I've seen with this program were able to complete their full recovery at home and not need a representation to the emergency department. Every so often we do have a few patients here or there that, just from what they're telling us, we do decide that they need to go back to the emergency department. But the best part about that is that they were able to reach out to us and we were able to assess them quickly and make sure they got to the hospital before things got really severe or critical. The remote patient monitoring program allows the patient to reach out to either me, the provider, or our accountable care nurses and care for them without the need for them to actually be here in office.
The feedback that we received from the providers has been very appreciative and valuable, that we are able to maintain connection to our patients in high volume and not just support their clinical needs, but also their social and emotional needs through the 7-day contacts.
We're excited about our remote patient monitoring program. What it's really about is us bringing care to you when and where most convenient for you. For a certain subset of people, being able to receive what used to be hospital care in their home, in an environment that's familiar to them with support, can be a much friendlier, easier, more convenient place to receive the care that you need.